Hello everyone, and welcome again to Your Whole Health with Dr. Taz. November 14th is World Diabetes Day, and it's important to really take a moment to understand this disease and understand its consequences for yourself and for the entire country. As a nation, it is our 7th leading cause of death, and we have almost 29 million people that suffer from diabetes nationwide. To me, that's not the most interesting statistic. The fact is that 86 million of us are at risk of diabetes. We're already pre-diabetic. So it's really important that we wrap ourselves around this particular disease, really try to understand it so that we're not just another statistic. Our first goal is to really connect the dots. What do we know right now about diabetes? Well, here's what we know. We know there's a genetic link. We know that there are two types. There's type 1, which is considered more autoimmune, more genetically based, more responsive to insulin therapy. And then there's type 2, which is usually our insulin levels getting stubborn and resistant because of weight or changes in our blood pressure or changes in our cholesterol. So we've got two distinct types, and then there's an in-between type that we're not really sure it shows traits of both. Current medical management of diabetes really focuses primarily on managing insulin, but through medication or through insulin. Where we really want to shift the conversation is to how you can prevent yourself or anyone else you know from getting this disease and not being another statistics for diabetes. Let's talk about the integrative or the holistic concept surrounding diabetes. The number one thing I would love everyone to know is to really understand your genetics. We talk all the time about the right diet, should you be vegan or paleo or gluten-free or all these crazy things, but clearly what we're understanding when it comes to diabetes is that you need to eat the way your ancestors ate. That's why we think we're seeing a huge rise in diabetes in the East Asian population, the Hispanic population, or the African American population, because none of those groups originally ate a Western diet high in grain or high in meat. They had a very different type of diet. So number one rule is to understand your genetics. Number two rule is to understand the glycemic index. If you can grasp this early on in the course of your health, then you'll save yourself so much hassle looking down the road. The glycemic index is all about making sure your insulin level never goes way up and never comes crashing down. It stays nice and even. And the key way of doing that is to kind of be consistent with protein and fat throughout the day. The number three rule is to really fix your belly. We know that if you don't have good digestive health, you suffer from constipation, diarrhea, belly pain, reflux, any of those things, then things like insulin are going to be out of control. And finally, we know we need exercise. We know insulin responds to exercise. We know that it makes a difference when you have an exercise program that works for you. So putting it all together and trying to make this practical and make it doable, what can you do? Well, here are my general rules. First of all, try to understand the diet that works best for you. You may need to be gluten-free or you may need to be vegan, but really take time finding the match for you, and maybe your physician can help you with that. The second rule is to eat consistently throughout the day. Don't skip meals, eat at regular intervals because it will prevent insulin from swinging throughout the day, which is the number one way to prevent diabetes. Finally, work on your digestive health. Really take a moment to figure out, are you going to the bathroom every day? Is there anything wrong with your belly? Do you have belly pain? Because we know insulin won't work well if you're having any of those symptoms. When you have an exercise program, think about exercises that will respond to insulin. So for example, you want to try to double your heart rate or really change your heart rate 10 to 20 beats per minute during a regular workout, because we know that's what really shifts insulin, not simply just walking at a continuous pace or being on a treadmill at a continuous pace. The heart needs challenge and insulin responds to that challenge. And then there are supplements that help, and oftentimes in the early stages of prediabetes, we know those things make a difference. Really thinking about going on an omega-3, which will help to reverse and change blood sugar patterns, going on something like chromium, which helps to lower your blood sugar, and then herbal supplements like Gymnemina, which comes from the world of Ayurvedic medicine, has worked beautifully in managing insulin and replacing certain diabetes medication. Obviously, none of this should be done on your own. You need the help of a physician to do this, but we know that preventing diabetes, looking at yourself from a pre-diabetes standpoint, is the first step in not becoming another statistics and having diabetes. I hope this information is helpful. Please take it into account on World Diabetes Day, November 14th.